What is cracking, Hope Nation? It is your friendly neighborhood Kevin Hines, and I am so very excited. Okay, ladies and gentlemen, family and friends, colleagues from all walks of life, welcome to another episode of the incredible Hinesights Podcast. I couldn't be more excited for today's phenomenal guest. She is a pioneer in her field and an incredible gift to humankind. Dr. Kate Truitt is a clinical psychologist and applied neuroscientist and is internationally recognized for expertise in trauma, stress, and resilience. She is the founder of the educational platform Truitt Institute and leads her award-winning clinical team at Dr. Kate Truitt and Associates. Dr. Truitt is a member of the Goldie Hawn Foundation Mind Up Scientific Advisory Committee and a co-developer of the Havening Techniques. Dr. Truitt passionately advocates for mental literacy and empowerment globally. Through her social media channels and as the author of Keep Breathing and Healing in Your Hands, she is dedicated to destigmatization of mental health and fostering resilience worldwide. Her brand new book is called Keep Breathing, a Psychologist's Intimate Journey Through Loss, Trauma, and Rediscovering Life. Dr. Truitt, welcome to the Hinesights Podcast. We are so glad to have you here. Thank you for coming on today. How are you?
I am so delighted to be here, Kevin. Thank you for having me. And I'm doing wonderful. How are you doing?
I'm doing very well today. Today is a good mental health day, which I'm very glad to report. Dr. Truitt, let's get right into it. What was it that inspired Keep Breathing, and what motivated you to share such personal experiences in your book?
Well, and it's one of those questions that we could easily also turn around to you with Cracked Not Broken, right? Which is such a beautiful, beautiful piece of literary and mental health work. So thank you for your generosity in writing that.
Thank you.
I think these stories matter. And in my own journey as a professional in the field, when I've experienced other quote unquote experts share their story of personal struggles as well as triumph, it really deeply resonates. And we're in a disconnected world right now. And I believe it's getting worse. And so it's so personally important to me to come down and share stories, to highlight the power of the human spirit, the resilience, and also to bring it all home that no matter what, we're all just human who have these types of experiences. And just even though I knew a lot of things, so that the book is a memoir, and it starts out page 1, walking up to the lectern to give the eulogy at my fiance's funeral. And it should have been our wedding, because he died a week before the wedding. And from that first page, it's saying, I knew so many things about mental health and trauma, about providing support for individuals struggling with suicidal considerations and addiction. And yet I'm still living in this nightmare scenario and navigating my own mental health while trying to simply keep breathing to survive. And those human stories, I think, and my hope is, will open up other opportunities for humans to connect and say, wait a minute, if it can happen to her, who's an expert, maybe it's okay that it's also happening to me, and we can talk about it.
And you, if you're okay with it, can you elaborate more on what happened to your fiance?
Yeah. His story is important because it's the story of so many. We were together for 10 years, and we met when I was a wee babe, 19 years old. And he had gotten quite ill over the past 2 years of his life. We didn't know what was going on. And eventually, he was diagnosed with psoriatic arthritis not too long before he died. He was in the midst of the opioid epidemic. And he was given, kind of sounds extreme, but it felt this way, platters of opioids and benzos and sleeping medications. And he became addicted. The complicating factor, as is so real for many of us, is the shame. So we didn't talk about it. I was living in the nightmare with him, and it wasn't a story that he would even allow me to reach out to get help with. I think I told one person, a very dear friend of mine, and he didn't survive. We had actually had him scheduled to go into treatment rather than going on our honeymoon. He was supposed to go into treatment, and he died a week too soon.
I'm so sorry for your immeasurable and incredible loss, Dr. Truitt. But you have come out of this to forge a path to helping other people. With your extensive study of trauma before and even after your personal experience, how do these kinds of personal experiences influence professional approaches to therapy, do you think?
You know, when I explore this in the book as well, my own childhood journey through trauma. And so many of us who are healers and advocates like yourself, we come to this work because of our survivalship. And when this started happening, and when he passed on, I had this incredible moment of reckoning with my own hubris of thinking I knew things. The irony of the prefrontal cortex. Like, I know things, I'll be fine. It doesn't matter what you know when we're in the throes and the depths of despair. And the other hubris there was I'd struggled with deep depression, suicidal considerations throughout my childhood, my teenagehood, my 20-somethings. And I thought I was recovered. Ha ha ha. The fallacy again of thinking we know all the things. And I went to a therapist who I'd been referred to, who I thought was an expert in traumatic grief, and she wasn't. And it wasn't her intention, but unfortunately, she re-traumatized me. And that's what and I tell the story in the book. Her name's redacted because my journey is never to do harm to others. But her lack of awareness around trauma and how trauma impacts the mind-body system, especially in therapy, had severe consequences on me and threw me back into the depths of really severe depression and PTSD. And so coming through that, eventually it took 5 years. I left clinical practice completely in that time because I couldn't trust my brain. And when I started practicing again, it was with this soulful purpose of being trauma-informed, neuroscience-based. We all have brains. And how do we guide and support individuals, not just in the field, but in the world, to better understand how to partner with their brains and with the brains of the people they walk alongside? It's funny how we all have this thing. The brain is a through line for all humanity. It's like thumbs. We have thumbs and we've got brains. We kind of know what thumbs can do and how they work. Most of us don't have a working model for what the brain can do and how to partner with it and help it. And so it's fundamentally changed everything I do in my life to say, wait a minute, we really have to talk about this.
Brain health is so important. It's so key. And we all call it mental health and mental well-being. But these things that we're really going through when we are diagnosed with a brain health condition, such as bipolar depression, schizophrenia, major depressive disorder, they're all brain diseases. And your brain is an organ just like every other organ in the body, and it too can become disease. But I feel like, doctor, maybe you can help me talk about this. I feel like when someone we know, love, or care about develops a brain disease or a mental health issue or crisis, people around them, maybe not you or me, but people around them often invalidate what they're going through because they cannot see it, so it must not be real.
Mm-hmm.
And so what is your assessment of actually having a step forward and having us as humanity look at the brain issues people have, address them, and help people with brain health conditions?
Schoolhouse rocks. Knowledge is power. When there's education around these different mental health considerations, brain diseases, mental wellness, and anything that's showing up in that space, then it's not scary. So often what I see in my patients, even in my own family and friends, is if somebody's struggling, especially with something internally that is not quote unquote visible to the world, and yet speaking about this internal pain, nobody knows what to do with it. There's a great adage of how if somebody's having a heart attack in a restaurant, people are going to jump into action and help. We are pulled there. If somebody's in the midst of a suicidal crisis in a restaurant and shares that they're struggling, people don't run towards. In fact, a lot of the times they run, exactly. They turn away, they push away. And so much of that is people don't know how to help.
Yeah.
And so what I've seen in one of my missions is to remove the stigma, just like in all of your incredible advocacy and every time you speak, Kevin, and your book and the work that you do on this podcast. We have to have the conversations. The conversations are a part of life. We can talk about, oh, I have high blood pressure, nobody feels shame. Well, why can't we talk about what's happening in our brain the same way?
And we really have to find a way to do that, and to spread across the world and let people know there's nothing wrong. There's no shame in struggling with brain pain, and there's no shame in asking for help. But if we're going to ask for that help, people around us have to be willing, able, and kind enough, and compassionate enough, and empathetic enough to understand what might be going on and how to give back in that moment. But in order for them to be able to do that, education is key. And it's more than just stigma now today. It's even discrimination. Mental health is the human rights issue of this or any time.
Yes.
Doctor, you've been through the depths of depression from before you lost your then fiance. You experienced suicidal concerns at 10 years of age. Can you help us understand what your experience was like then and how it has impacted your life since then?
Yeah. Working in the field, the neuroscience of a brain in crisis is an area of deep passion of mine. And especially having experienced a crisis brain state so young and not knowing what it was at the age of 10, I didn't even know what was happening to me until I learned about it in a Christopher Pike book. I don't know if you ever read those old books. Who's like a young adult thriller author. And he was talking about it in one of his books, and I was maybe 12 or 13. I was like, oh. So I learned about from a fictional story that helped me put a label to what was happening.
Mm-hmm.
And that, when I do my work today, is such a critical through line. I reflect on, what did my young self need? And also, what did the caregivers in my life need? Because they were not equipped with the skills. And when I went to them for help, they didn't know what to do. They were well-intentioned, and it was flooding for them. It was not, I grew up in the Midwest in Kansas, and it simply was not a topic of conversation. It was, well, to your point of pushing away. Like, well, we don't know what to do with this, because they were scared. So in hindsight, having those experiences, while awful, have also been a catalyst for my purpose now. Wow. On all levels. And so working with the Goldie Hawn Foundation's Mind Up programs, which is an incredible organization. If any of your listeners are not familiar with them, look them up. Goldie's knee deep in all of it. It is truly her heart song. And we're bringing mental health awareness and social emotional learning to schools all over the world. If we have the information, if the children have it, the parents have it, the communities have it, that changes the trajectory of future generations.
Psychoeducation is so key for people who may be going through this kind of struggle before it becomes something so dangerous, so that when they learn about it at a young age, they can know what to do if it ever arises. Yeah. Very crucial.
Yeah, or just have data. Just go, oh, I have a word for this thing. Simply having a word for something is a game changer, because if we have a label, our brain loves labels. And so if we have a label, that means enough other people have had this experience that I'm not alone. I mean, healthy labels, not unhealthy ones.
That feeling of not being alone goes a long way in your own personal healing. When you feel somebody else is struggling with the same thing, you feel less siloed and less vulnerable. Doctor, how do you prioritize self-care and nurture your own brain and mental health, given your personal experiences?
So I'm very blessed to walk alongside incredible humans in the organizations that I'm a partner of or that I run. And in my primary home-based clinic institute here in Los Angeles, we've created a culture of transparency and support and engagement. And part of that is something we call militant self-care. And it is a through line of our conversations. It is a through line of the work that we do. How are we prioritizing and mandating that we're taking care of ourselves and also holding each other accountable to do so? And to the point of that belonging, that is one of the greatest gifts, because we can all get slippery in our self-care. It's so easy to stop prioritizing the self, especially as people who give so much of ourselves for a living. So having somebody walk down the hall and notice a nuance and go, hey, have you done XYZ today? Or did you do this morning? Or did you do that? Or how's that going? And holding us actively accountable changes the game exponentially. Absolutely. So it's village and being in having a playground, playmates in a playground, as they say, that shines the light on how critical it is to do the oxygen analogy on the airplane. Oxygen self, then take care of others.
And Doc, Kate, given your personal journey, how does this and what you've gone through influence your work with the mental health organizations that you've either founded or the boards that you sit on today?
It's all the reason I do it all. The opportunity to play a role in a bigger global movement, as you were just saying, like mental health is, and we look at our own, Surgeon General in America, we look at the stress and loneliness epidemic that even the UK is highlighting as well. Like, this is global, and to play one small role in helping one other person have the opportunity to show up a little healthier, a little more stronger, a little more compassionately in their own lives. That one small movement for humanity creates a ripple effect, the butterfly effect, going forward. And that's pretty cool. And it's a huge honor to be a part of it.
I would agree with you 100% there. We are cogs in the wheel of a larger change, helping to give back, because giving is the true receiving. And giving back is truly the purpose of the human being. It's to give back to those we know, those we love, those we don't know from Adam, and yes, those we don't even like. Because we're here to make change in someone's life, and it's for a brighter future. Kate, as a psychologist, where sharing personal stories isn't typical in training, as a matter of fact, for a long time, it was shunned. What has it been like knowing your story will be out in the world in such a vulnerable way? And why did you choose to open up as you did in your books, in your work, in your life, on this podcast?
Yeah. Oh, man. It's been an interesting journey of getting to know many young parts of me. To really, I was having a really wonderful session with my own psychologist this morning, and he shared with me a beautiful reflection as we were wrapping up the call of, there are young parts of me who will always have terror. And is my job now as the adult to know that and to love them and care for them. And that my adult self is aware that we're doing the big things for the bigger purpose. That does not take away from those young parts' emotions and the validity of that. And that really jumped out at me, especially coming on this podcast and really reflecting on the conversation I knew you and I were going to be having. As in psychotherapy, we're supposed to be blank as the provider, to receive the information and use that information to support the healing process. I think as human, well, I know as humans, even as a neuroscientist, we thrive in connection. And to know that other people have experienced this, that we're not alone in the journey, it is so, so, so deeply important. So telling my own story it took me 5 years to write this book. For context, I wrote my first book, Healing in Your Hands, in 8 months. as I love writing. I've always been an author. That was a very accessible clinical book saying, here's how you learn about your brain. Here's a lot of great tools for brain partnership. And I wrote that book in the middle of writing this one, because this one got so heavy and so big and so sticky that I couldn't find myself in the weeds of how to sit with what I had really experienced. And writing that book helped immensely to give me even my own support to go back to Keep Breathing, the new book, and say, wait a minute, that those things that happened to me, they happen to so many people. And if I can be yet another voice saying you're not alone, then I want to be able to be that voice.
Well, you clearly are that voice, and you're changing lives, and you're doing some phenomenal work on a very large scale, a global scale. And it's incredible to see. Doc, my final question is, I think, a really important one. What do you say to the up and coming psychologist who has a lived experience, expertise of going through something very traumatic and has, in all essence, triumphed over some kind of adversity? How do you express to that individual to share some of themselves in their sessions with their patients to give hope to them?
Yeah, that is a beautiful question. Going back to the oxygen on the airplane analogy, the first step is to really move into relationship with the story and the triumph, to really have a deep understanding of the mind-body system's emotional response to it. Is there still healing to be done? Is when we're sitting with somebody else in their pain and their wounds, that is us being in service of their work. So before we bring our own story into that, being very clear on our intention and in deep brain partnership with what may be coming up for us as we do that sharing is our job as a profession. Resonance and empathy is beautiful, and it's so important that we take care of ourselves and our brain in those moments. And then it's a really beautiful exploration of what little bits of the story may be helpful, and really knowing why. Why are we bringing this in? What is the impact of this share? And is it going to be in best service of the client? That's one of the big things I talk about in supervision with my own team and in the trainings we run. When we're in our professional role, we are there in service. If there's any part of us that's saying, I want to share this because it will help me, that's not therapy. That's where you go to your own therapist. If the story is being shared with what you said, receiving and giving, we know we will benefit from that. If the story is being shared from a space of this will continue to foster their own ongoing growth and be in support of that, absolutely share and allow that to be a part of the journey. Humans need connection.
We need connection. We need hope in our darkest of hours, so that we can recognize that just because we're in a world of pain today doesn't mean we don't get to have that beautiful tomorrow. We have to be here to get there in the first place. Yeah. Dr. Kate Truitt, thank you very much for coming on the Hinesights podcast. To everybody viewing, listening, watching, and subscribing, if you happen to be right now in a world of pain, keep listening to these episodes, go to a previous one. And if you know someone in pain, share these episodes with a friend in need. Share this particular episode with someone who needs to hear it today. And whatever you do, fight to be here tomorrow and every single day after that. You are loved, you are worthy, you are valued, and you matter to us. Please stay. Take care, be well, and be here tomorrow.